Welcome to the new EU podcast series, How to Prevent Anxiety in Children Undergoing Urological Procedures. In this second episode, we are joined by Dr. Lisette Hoen and Dr. Sofie Schilling. Together, they will explore non-pharmaceutical preventative measures for reducing anxiety in children undergoing urological procedures. Join us as we embark on this informative journey.
So we are here today discussing the non-pharmaceutical interventions to prevent anxiety in children undergoing urological procedures. I would like to start by introducing my colleague.
My name is Sophie, and I'm a child life specialist here in the hospital for about 3 years now.
And my name is Lisette, and I'm a pediatric urologist. And we both work at the Sophia Children's Hospital at the Erasmus Medical Center in Rotterdam, the Netherlands. So we're going to discuss today a bit more about anxiety prevention in children. And I think that it's important to start with awareness.
Mm-hmm. Yes, I think that the awareness for the anxiety prevention are about different subjects. And the first thing that I will do in a situation when the child is in the hospital, to assess the needs of the child and also the parents, of course. So we have a little chat with the child if they are able to talk, of course, and with the parents. So what are the needs? Is there a medical history? Things like that. Because for a toddler, you have a lot of other options and you play more, and with the older children, you talk a lot more.
So what you mean is that it's important that you have appropriate information for the child age.
Yes.
That is key in the assessment. And
yes, because when you talk to a teenager, you have a lot of different conversation than when you talk to a child at the age of 4. So I think that's really important to know the age, and the history is also important, I think, because maybe they already had a trauma or maybe some really good experience. That's also important for us to know. So we talk a lot with the children, but also the parents are important because at the end they know the child the best. So we also talk with the parents a lot.
So you do a system approach.
Yes, the system is important. And sometimes also the brothers or sisters are in the hospital, and then we also involve them because they're also part of the system.
Yes.
So that's important for us. It's also extremely important, I think, that when you have all the information about the system and what it's important to check if the children knows why are they here in the hospital and what's going to happen. Because it's the same if I tell you, you go into the room and you don't know what's happening, if there maybe are spiders or it's just party or you don't know, it's also scary for you. So imagine that for the child, if they don't know what's going to happen or what the doctor is going to do, it's really scary for them.
Yeah.
So that's also important to check from what did your parents told you, what you already know, what did the doctor told you, and then what the child tells you, you can move on with that.
Yeah. I can imagine that especially when you're working with different specialists that send the child to you, that the starting point is different. So it's good to check where does the child start, so that you know how to move forward.
Yes, because and sometimes the parents already told the child a lot from going to the hospital for an operation or maybe just a picture or it doesn't matter. And sometimes the parents don't tell the child anything. Yeah. So I must tell why you're in the hospital today. Just visiting the doctor, but they don't know they have an operation in 2 hours.
Yeah.
So that's also important for us.
We need to be sure that we create awareness. Mm-hmm. And one of the things is that we want to keep the child in control as much as possible.
Yes. It's important for the child to keep the control because it can be overwhelming in the hospital sometimes because also when they're in the room, people walking in and out and they have to do a lot of things. When they have the child has the feeling that they also can choose what they want to do now or which arm the doctor looks at first. They feel, I can also say what I want. And they feel in control. And it helps to give them some confidence in the situation. And I think that's also really important for the child. And at the end, is also help to prevent anxiety.
Yeah, definitely.
Because they can say what they want. And it's not all that, well, now you have to do this. Now you have to do that. They can say, I want to do this first. And then we're going to do that.
Yes. So give a part of the control, but also keep the options limited, maybe?
Yes, because if you say, sometimes the doctor say, can I look at your leg? And then the child says, no, what's next? If you say, are we going to first check your temperature and then, or look at the leg, what do you want first? They know it's going to happen, but they can choose what they want to do first. Control and confidence for the child. Yeah. It also helps to prevent anxiety.
It's something that I would want to have happen. So I can imagine that children want the same. Mm-hmm. This is something that we can do for the child. And what is something that we can provide for children. So when there is a urological procedure that might create anxiety, are there different techniques that we can use?
Yeah, for sure. We have a lot of techniques, and actually they're all quite easy. For an example, bubble blower. We can blow bubbles, and then I'm going to ask the child, how many bubbles can you blow? How many bubbles can your daddy or whatever who's with the child blow? We also use a lot of look and find books. I'm going to make a game, who's finding the dog at first, or we make it a game. For the older children, we use the VR headset, VR glasses. They really like it. It's really cool, of course, because they're really in the game, or they can check some movies and then swim with the dolphins. And that's really cool for the older kids. Easy things like a stress ball can help them. Sound toys for the younger children with glitters and colors, or things with sounds. A lot of things.
You also mentioned that not only distraction is important, but also to make them do something different so that they have a different task.
Yes, like a cognitive distraction.
Yes,
that's right. Yes. So you give the brain a task, and then there's no space anymore for what the doctor's doing.
Yeah,
quite easy said.
That's more than just a distraction.
Yes.
But so making an executive function happen.
Yes, that's really important, because then, what I said, the brain has no room anymore for what's happening, and you check with the child, because sometimes the child want to see the procedure or just want to help the doctor, and that can also be very useful. So you have to check with the child. You want to look in the look and find book, or you want to see what's happening.
And one of the things that we, of course, hear very often in clinical practice is, well, it's in the middle of the night and we don't have the child life specialist available. What can we do? But then we came up with something that we said, keep it simple, stupid.
Yes.
So what can we do? What kind of tips do you have for us in the emergency room?
Use everything that's there. Can we count how many steps are on the ceiling? Make a balloon from a glove. Talk with them if they're a little bit older about what sport are you doing, what the rules in the sport, how many friends do you have. Give them something to think about, ask about the last holiday. Ask them anything to let them think about other things than the procedure, because that will give some distraction, and that's very helpful.
Yeah. So that is a very helpful tip, I think, because, of course, when you're available, then we will use you.
Yeah.
But indeed, it's also nice to have some tips and tricks at hand for in the middle of the night.
Yeah, and it's very easy because everyone can do it. You're not really, for the simple things, you don't need me. Someone as a doctor or assistant or anyone can use the small things to make it better experience child, and that's important.
Yeah. So now we talked about the toddlers, we talked about the older kids and the adolescents, but even though we might not always expect it, neonates can also develop anxiety due to urological procedures.
Yes.
Are there things that we could specifically do for this group of patients?
Yes, there are a few things that you can do. What you said, sometimes we think, oh, they're just little, they won't notice it or they won't feel anything, but they do. And the tips that we give are sometimes you can breastfeed the baby, because the breastfeeding makes the child suck, and that naturally release endorphins in the body, and it's also some natural painkillers, and it will help to make it a better experience for the baby. I had an experience with a mom who was breastfeeding her child, and the child was they're taking blood from the feet.
Yeah.
And the mom was breastfeeding the baby, and baby just chill. It was just sucking.
Didn't notice anything.
No.
So that's one of the good things.
Yes.
So some people might think that breastfeeding during a procedure might give a negative emotion.
Mm-hmm.
But you always tell me that that's not true.
No, they're not associated things together. If one of the times that they get breastfed and a medical procedure, they're not going to link it.
Okay, so that's always good to know.
Yes.
And what if a mom doesn't breastfeed? What are there other options?
Yes, rose water. It's water with a small amount of sugar. And it has been shown that it also reduces pain with the newborns. The sweetness can trigger a calming reflex, and that distracts the baby also from the procedure. And then one other thing, if they can't drink anything, just let them suck on a pacifier, because the sucking reflection is really important. And maybe if that's difficult or there's not a mom nearby, then also skin to skin is very helpful, because you put the baby on the dad's chest. It's the body temperature, the heart rate, and the breathing are regulated, and it also helps to reduce a lot of stress.
Yeah.
So that's small things that you can do to help help the little baby.
Yeah, so to work a bit around the baby, to make sure that the baby is comfortable, in order to make sure that there's no anxiety created. So I think we now have a good overview of what we can do to prevent anxiety in the different ages and also at different times.
Yes.
So we hope that this podcast provided you some practical tips and tricks on how to prevent this anxiety. Sometimes it is necessary to use some additional pharmaceutical measures, but for those options, we would like to invite you to listen to the next series.
Sounds good.
Perfect. Thank you.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.